try something a little different. We're going to react to some plastic surgery videos. And the goal here is to try to get some educational value and enlightenment out of these videos and see what we can come up with. So
cool.
For the first video here, Bridget, you want to kick it off?
This video is called 10 Worst Cases of Plastic Surgery Gone Wrong. Very informative. This is quality. Can you hit play?
So here's a woman who had buttock implants, and the implants have slipped to a subcutaneous position. So they're quite large, and you can see them very easily. And also the pocket that they exist within is too big, so they're moving around, and the woman can manipulate the implants and push it around. This is also why Brazilian butt lift or fat grafting the buttock is much more popular. It's much better to use your own fat to augment the bottom versus an implant.
Totally. Let's see what happened to Vishal.
Oh, this is sad.
Unfortunately, the first visit led to an infection in his nasal cavity, leading to repeat appointments that kept going bad. Finally,
well, there were more than repeat appointments. There was repeat surgeries, and the surgery looks like it destroyed the midline structure inside the nose, which is this part that goes all the way back.
Do you know him?
Septum. Do I know him?
Yeah.
How would I know him?
Oh, I don't know. You're talking like you know him. Sorry.
I can look and see that his septum and all the midline structures are gone.
After the 21st surgery, his nose had been cut off.
You know me?
Certain to make sure he could at least breathe. Poor guy.
And after a divorce.
Oh, I hate looking at myself.
These are his before pictures.
He looks great.
For once.
Wait, was this pre-COVID?
So there are.
With the mask?
This is what 22 surgeries have done to THAKKAR.
This is not fair, and nobody should suffer what I had to.
The first surgery
So
was in 2000.
it's interesting to look at his nose and figure out what is actually missing here. So we can see the ala on each side, but the central part of the nose, the tip, and this part right here, the columella, are missing. And so all we're seeing there is the two ala, and there's just a defect here. And the reason that they have this big tube in is to hold that open so it doesn't shrink down.
Nobody should suffer what I had to.
The first surgery was in 2006, but afterwards his breathing became a problem.
There were 7 surgeries done on your face in 53 days time frame. It hurts 2 things. First thing, it stretches the scar. It reminds me what is on my face. That takes another reason to smile.
So he has a scar here because he had a nasolabial fold flap. So this line between the nose and the corner of the mouth is called nasolabial, and you can take sort of a tongue-shaped piece of tissue, elevate it, wrap it around, and use it to create the tip of the nose. And they tried to do that, but it didn't work very well. And I would also say you don't really know what the full story is here. If the patient had something going on that contributed, or if it was simply a bad infection that occurred, or overly aggressive surgery. So, for example, cocaine can cause necrosis of the nasal tip.
Yeah.
Well, I hope he's doing better.
Yeah, we should Google him.
Obsessed with looking to stay young, 48-year-old Miyuko would repeatedly visit cosmetic surgeons to get whatever treatment she desired until they would refuse to continue seeing her. Still unsatisfied with how she looked, Miyuko injected cooking oil into her own face, and it wasn't until things started going wrong that she sought the help of surgeons and doctors. After infection spread, doctors had removed more than 250 grams of cooking oil and other substances from her face, neck, and other regions of her upper body.
So I've seen oil injections and silicone oil injections.
Wait, time out. She did this to herself?
Apparently, or she had somebody do it. You can go to these like backroom plastic surgery clinics, and non-doctors are doing all kinds of things. Silicone is one, oil is one, and also for breast. I think you saw a woman who had oil injected in her breast with me.
I mean, this is just. Do you think this is real?
とても後悔してます
その苦しみを語る映像に韓国
No, you're looking at pixels on the screen. So, did those pixels represent an actual person? That's a philosophical question.
Okay.
中が衝撃を受け
Do you understand the
ミリオン
Korean?
の手術費に充ててほしいと寄付が集まった
Oh.
それはアモイラ
Number 7, Regine Narain-Singh. In 2005, Regine desperately wanted to change up her look, so much so that she'd rather than saving up for a proper surgeon she couldn't afford yet, she went to a back alley surgeon for just $3,000. This is a prime example of why patience is literally a virtue. She wished to have injections in her cheeks, lips, hips, and chin.
Yeah, and unfortunately, this is not uncommon.
Substances such as
Having-
flat, super glue, mineral oil, and a couple other things that pretty much became almost lethal. Now, luckily, a group of surgeons removed these substances before they really did any harm and managed to fix
Looks like they still did a good bit of harm.
Well, it's been a few months since the story of my botched cosmetic injections by O'Neill Ron Morris, aka Duchess, went global.
Wow.
Supposedly, Duchess was concocting a mixture of cement, Fix-A-Flat, and mineral oil, and she was injecting it in people.
Number 6, April Brown. From a young age, April always felt unappealing to
Attractive
men
woman.
and
Beautiful.
herself for a lack of a lower bottom. Feeling so, a client of hers from her work offered to do a back alley injection at her home for a cheap price. Obviously excited, she said yes. She was scheduled at 4 different injections, but before the second time, she felt something was odd when the woman would leave her house in the middle of her own injection. So
Oh
she
my
requested
goodness.
to stop,
So
which
she
luckily for her
lost
saved
her
her
hands
life.
and
Now,
her
she may have
feet.
lost her butt and become a quadruple amputee, but she would be dead otherwise.
Wait.
The buttocks started to get hard. That was the first sign. The second sign was discoloration. That was the second sign. The third sign was itching. And then came the biggest problem of all, was the pain.
How bad was that pain?
That pain, I'll always say, was like a toothache, labor pains, and throw in a migraine.
So,
Well, actually, when I
so here's what can cause this. There's an infection can cause this, similar to meningococcemia,
Right.
which causes a disseminated intravascular coagulation, especially affecting the small vessels. And the other thing, but I don't think that's what happened here. I think she had embolization. Embolization is when that substance that was injected gets injected into the bloodstream instead of into the space between blood vessels. So in order to get out into the artery and clog the artery up, so we have one big artery, the brachial, and then it splits into 2 and becomes the radial and the ulnar artery. So to block up the brachial artery or block up both of the forearm arteries, you need to get into
But all
directly
4?
into the artery. So yeah, because if you inject into one of the bigger arteries, you'd have to inject up higher somewhere, or you'd have to inject below and it go retrograde through the artery. So you have to inject under pressure. Now, if you inject a vein, that substance can't go through the vein, back to the heart, into the lung, through the capillaries, out of the lung, into the left side of the heart and get pumped out. So just injecting the vein probably wouldn't have done this.
I've been living in pain for so long, actually it was a relief for me. I was like, oh wow, at least I won't be in pain anymore.
Number 5, Monique Allen. Monique, originally born male, has around 100 unregulated plastic surgeries and over 200 procedures in total since being 22. This led to her becoming disfigured and disabled, with more than 12 liters of plastic having to be removed from her entire body. Never being fully satisfied with her appearance, she has spent more than a total of $100,000 throughout this entire process.
There has to be some kind of
Look at this.
image
enhanced people on the planet,
distortion.
undergoing an estimated 200 cosmetic procedures.
I definitely went off the
So she has symastia and she's got really gross contour deformity of the breast there.
Despite leaving her with an extreme appearance and ongoing health issues, she still feels there's more work to be done. Monique from La Habra, California, has shelled out hundreds of thousands of dollars over the years, striving for the body she craves.
I was definitely obsessed. I pushed my obsession to the limit. I think it was an addiction, just like drugs or alcohol is an addiction. I've had my lips done maybe 20 times. I had my breast done 9 times. My hips done 8 times. My ass done 10 times. There's probably many, I can't even remember.
However, there is one surgery she certainly doesn't regret, as Monique was born a boy called Johnny before undergoing gender reassignment surgery in the 70s.
My reassignment surgery. It was very important to me, and thank God we live in an age where science can give you that.
Well, it's nice to see somebody who had a gender reassignment who
Number
seems
4,
to be more
Joseph
comfortable
Swain. At the time,
as
was
the other
something
sex.
called diverticulitis, which in short causes discomfort in bowel
They've
movements.
mispronounced
Usually what doctors will do about this is install a
diverticulitis.
temporary bag for feces to lie in. After, surgeons will remove the bag and reattach his colon, but they accidentally stapled it to his bladder. Because of this, Swain literally dealt with dick farts for 2 weeks. Yes, I did say dick farts, and he had to deal with this until doctors corrected this mistake.
So
but
What is this?
So this is a
Number 3,
fistula,
JOCELYN WILDENSTEIN.
an abnormal
National
connection
High Court
between
now
the
ex-husband,
colon
ex-Wildenstein,
and
had a shooting
the
range.
urethra
Mentioning
or
this
the
as he wanted JOCELYN to look
ureter.
cat-like
But the
because he
ureter
had a
is
weird
back
thing for
there and
what it
it's
feel like.
actually easier to get
I
into
know.
it than you would
Following
think.
their divorce, it was revealed that
You
all
can't keep up
surgeries
with this
totaled
stuff.
more than $4 million.
Look at this.
Could have saved a lot of money if he just literally would have bought a latex Catwoman suit, but nope.
Well, it's sad because you can see the emotional anguish of these patients on their face or on their body, you know. And you wonder
Number 2, KRISTINA
what kind of a
Having
surgeon
somewhat of an
would
obsession
keep
with
operating
fictional
on somebody.
characters like Jessica Rabbit, KRISTINA wanted to have injections to make her lips resemble those of Jessica's. Unfortunately, no one really told her when to stop injecting her lips, and even
I'll bet
she
somebody
kinda
did
ruined
tell
the
her.
I mean,
procedure.
shit, this.
Now, holding the world record for the largest lips, with every surgery costing around $60 and admitting them to hurting somewhat, KRISTINA claims that she doesn't plan on stopping anytime soon.
Why does she have bullets coming out of her head?
No, they're piercings. Whoa. Wow. Not a good look for me.
No, you can see her lip is not actually that big because she's put
Yeah, she's
either permanent
overlined.
makeup or
And finally, number 1, Pete Burns.
tattooing
Even
over
after
it.
doing this list, I don't exactly understand the appealing side of getting multiple surgeries, but Pete would disagree completely. First, beginning with a simple nose job from the earnings he got with his band Dead or Alive, Pete soon became obsessed. Constantly changing his face around because he
Look at
gets
that.
bored
Are
of his
these
own
real
look.
pictures?
Pete repeatedly goes
I
back and
asked
forth
you that and you
changing
said
his
there was
face
some
looking
pixelated
botched
thing.
or not.
Don't you think that these can't be real?
And it was fixed.
I
If you can fix it, if it goes wrong,
It
you
looks
can fix
real,
it. I
but
don't see there's
it's
any big
hard to
drama.
believe this is real.
The nose was fixed, and Burns has continued to alter his appearance with makeup, tattoos, hundreds of injections, and surgeries.
Put all together through 2 hours of pain and then have 18 months of self-satisfaction and walk around thinking if only, but I haven't got the courage.
I see it as an
I
art form.
don't even know what to say.
I see myself as my own clay, and I was remodeling it.
I want you because it paralyzes your face and you go like Betty Davis on smoke.
And so where do you think this design...
Just goes to show no matter what you say, if you have an English accent, you can get away with it.
Childhood, when I was getting bottles of Dylon shoe dye and pouring them over my head to make my hair green.
But in 2000, a near fatal decision. A lip implant that would change his
Oh,
face
boy.
forever. That would take Pete Burns to the verge of death. The surgeon, Dr. Maurizio Vile.
And I developed rashes and stuff around the mouth from it, and he'd just say, oh, I'll put some steroids in, the rashes will go, and then I developed lumps, and he'd say, that's a deposit of the product. What I'll do is put more product around it, bury it, and he just kept injecting me and
Oh
injecting
boy.
me.
After 4 years,
This is a problem.
crisis point,
I woke up after doing a song with
Well, it
his
just goes to
sisters,
show if
and my lip
plan-
was at least 18 inches away from my face, the lower lip. It was huge, like this big.
18
No,
inches?
Swollen, like a bangy. But when you wake up and your Adam's apple has come out here further than your jaw, on one side of your face is so swollen you can't open your eye, and there's yellow discharge, not just leaking, squirting with a hiss. It would squirt from my face. It was like one of the worst science fiction or horror movies you could ever see.
And with all that being said and done, that concludes 10 worst cases
Wow,
of
Dr.
plastic
A.
surgery gone wrong. If you've enjoyed
Yeah.
the video, make
Well, the only thing I would say here is that
You're
I
pretty
don't
good.
think you should call all of this plastic surgery as in plastic surgeons having performed them. These are all body altering surgeries and procedures that are misadventures. But I don't know that any single one of them was done by an actual plastic surgeon. Hopefully not. I hope you got a little something out of that, and if you're considering plastic surgery, don't consider getting your surgery or your procedure done by somebody who is not a credentialed professional.
Yeah, that's good.